Recently, Armenian American Health Professionals Organization AAHPO held an annual General Assembly at Rosy's restaurant in New Jersey. The gathering began with opening remarks by the president of AAHPO, Lawrence Najarian, who first invited Dr. Anna Harutyunyan, new member of AAHPO, to read the organization's statement.
We're a really non-political group. We represent all denominations. Our members come from all over the world, all different ethnic types of Armenians. But what our guiding principles really are working together and collaborating with like-minded organizations. And this organization, I'm told by others, but it's also my personal thought, really proved its worth. We had trial runs with Hurricane Sandy and other natural disasters, but all of those trial runs came to the forefront when we were challenged by this pandemic. It was a multifaceted challenge on every front, and it was amazing how so many different members from so many different fields in medicine, from social work to nursing to our computer people to our internists and surgeons, all stepped up and volunteered to work together with the general Armenian community, all the nonprofits, in a collaborative way that really cemented this organization's position in the Armenian community.
Dr. Meruzhan Maljian was elected temporary chairman and secretary of General Assembly for the day. Vice President Dr. Karbis Baydar presented opening comments.
My journey with AAHPO started 20 plus years ago. It was late Horen Albanian who asked me to join. God bless his soul. He was a great friend. And the reason was AAHPO needed Bolsa High presentation. There was no Bolsa. So I couldn't say no to Horen because I really loved him. So I joined. The problem is, a year after I joined, we were sitting at a table at Armenian Presbyterian Church, and we were voting on should we continue or should we dissolve, because nobody was coming to meetings, nothing was happening. So I voted for we should continue, because I just joined a year ago. I don't want to be a loser. And Larry didn't want to become a loser too. He also voted yes, we should continue. And with very narrow margin, we decided to continue. And thank God we did. And thanks to you all the people who work hard. I see so many faces who've done so much work for AAHPO before. And thanks to our president, Larry Najarian, we are here today.
Talin Gergerian gave reports on upcoming events of 2022. Joyce Kurdian MD, AAHPO's treasurer, presented a report on organization's revenue sources, including new programs implemented in 2022, such as stock donations, Amazon, Roundup, Christmas card, SME events, and more. Dr. Deborah Furman, an executive board member, spoke about AAHPO's work providing medical supplies to Armenia. She also gave update on Tufenkian Foundation.
Basically, the functions of the Medical Supplies Committee are transitioning. We still deal with supplies. In September 2021, they made a new rule, that prior to sending any supplies to Armenia, we need to have an inventory list that must be sent to our contacts in Armenia. The hospital contact must then provide a letter stating that he will pick up the supplies and accept the donation. So once that letter is obtained, we can send things to Larry's office, who will get them sent to Armenia. We've also interfaced with the Tufenkian Foundation, who's doing a program in southern Marduni, trying to improve healthcare there. They've renovated some health clinics, and we're planning to bring AEDs to the clinics, automated defibrillators. But after hearing the initial proposal, AAHPO gave some input. And basically, since we couldn't guarantee medical infrastructure after the AED resuscitation, they've decided to use their resources a different way. And we had suggested focusing more on prevention for heart disease and stroke.
Kanarik Khachaturian, PhD, spoke about AAHPO's medical workshop program.
We had one schedule. Every year we used to have 3 or 4 times medical workshops, current, very updated information from specialists that will come and talk to the various churches. But this time we had to cancel it because of COVID, and we are rescheduling again at St. Leon Church. The topic is opioid and vaping, and it was very popular because it spread like fire. So please read the news from the AAHPO. You will see the date there, and you are all most welcome to join us at St. Leon Church.
Lucy Tovmasyan MD spoke about AAHPO's Welcome Back Walk in September 25, 2021, as well as organization's 5K Walk fundraiser.
Where we had some teams, so we're thinking of for the 5K maybe using that team mentality so we can have sponsors not only that donate money but people that get together as groups and can raise money for our cause as well. So we have a lot of really fun things planned with events for the kids to have fun runs and try to get everybody together and everybody involved. So whether you want to help out or actually run or walk or just sponsor any of the people who are doing any of these things, we encourage all of you to come out and join us. And it will be sometime in the fall.
Lena Merjanian MD spoke about mentoring forum and advisory program.
I think one of the most important things is to streamline the questions, because sometimes it's very confusing for students or even their parents to kind of figure out when they have a question for their high school kid, their college kid, their medical student. Who can they ask for a question? So we try to streamline that by contacting us through our email, by phone call, and then we go out to the people that we know in the community who can help these students get some of the experiences that they're looking for. And I hope that we continue.
Kim Hekimian, PhD, discussed the improving of public health and the healthcare in Armenia.
And I think that all of us understand collectively that the world is suffering from what we call the infodemic of misinformation and disinformation, and Armenia is no exception. And I think when it comes to COVID-19, we still are hovering at around 1/3 of the population having the vaccine. And it's been very difficult to try to move the needle on that, to try to get more than that vaccinated. And interestingly enough, it's the oldest population, the population over age 65, that is the least likely to be vaccinated. And that's in part because one of the ways to nudge people to get vaccinated in Armenia was to make it a mandate for going back to work. So those who were already retired didn't fall within that policy. And so I think the challenge is to figure out how to expand vaccine, knowing that vaccine will not prevent the infection, but will prevent, for the most part, hospitalization and death. So for the recent Omicron surge, Armenia did suffer quite a few deaths, but right now they're in a, as we are as well, in a sort of a low, actually that's not true now, we're sort of going through another surge, but they're sort of flatlined. They do not do universal testing. They don't do universal testing in any hospital sphere, so that's also very different. So if you're going in for surgery or labor and delivery or something like that, you're never tested going in. And I think that's part of the culture that is just different from us and hard to change.
Annual General Assembly ended with many plans and projects planned for the near future. In these uncertain times when COVID-19 is still with us and Armenia and Artsakh are in unprecedented danger, medical assistance provided by AAHPO is more important than ever.
Thank you so much to all of our volunteers, all of our physicians, all of our donors. We have an overhead to carry to get our message out there, and we could not be without those pillars of volunteers on all the fronts. So I want to thank each and every one of you for being here and sharing this with your friends. A lot of what we do is really out of the generosity of our membership, and we don't look for anything back, but we do look forward to you sharing our information about our group with your friends and family. Get those email people signing up to our and subscribing to our medical alerts. And if you have other ideas, always feel free to share. So really heartfelt thanks from all of us on the board to each and every one of you and your families.